This is one of those first studies, and it's a study in which the authors looked at all-cause mortality and cancer-related mortality in people under the age of 60 and over the age of 60. And you can see that they've divided people into the lower, middle, and upper third. We call those tertiles. So if you're under 60 and you are the lowest third in terms of your strength, you maybe have a small increase in risk, but it's not really that big of a deal. Over the age of 60, however, if you're in the lowest third of individuals in terms of this is leg strength, you have an exaggerated risk for both all-cause and cancer-related mortality. Compared to those in the upper third, so you don't even need to be in the top 10% or the top 20%, but it'd be good to be in the top 33%, and you have a vastly reduced risk. It's almost half in terms of all-cause, and I think it's almost 3.5 times lower for cancer-related mortality. We've got data that's a little bit more granular now, and these authors, this was a paper published just last year in the British Journal of Sports Medicine, have shown the relationship between the amount of muscle strengthening activities done in minutes per week, both all-cause, cardiovascular disease related, cancer related, and diabetes related. You can see that the curve sort of goes down and then flattens out and then actually maybe begins to inflect and goes upwards. So the authors highlighted the largest relative reduction in risk and the amount in terms of minutes per week of muscle strengthening activity that you would need to do. For all cause, 40 minutes. For cardiovascular disease, 60 minutes. For cancer, 30 minutes. For diabetes, it's 60 minutes, but actually the line continues to go down. So let me just say that if you could get out and do some form of strengthening activity, maybe once a week for 30 minutes, twice a week for 60 minutes, 30 minutes at a session. You don't need to lift the heaviest things you can, even light weights lifted to reasonable levels of effort or fatigue work very, very well. You're going to enjoy a reduced risk for a number of diseases. And this is an area that is growing. And we don't know as much about being stronger and what it does for you, but we do know that it does reduce risk almost to the same extent as being cardiovascularly fit. So I'm going to show you, I think, what is some of the, putting it all together is when you're both fitter and stronger. So you're following that 150 minutes a week. You're doing those 2 days a week of muscle strengthening activities. And here's what happens. And so this is a fantastic paper that just came out last year, talking about, do we do aerobic work or do you do muscle strengthening work? And, my urging is that there's neither one is better, but both of them together are better than either alone. So I'll show you here. This is what we call the hazard ratio of mortality, all-cause mortality, so all deaths, cardiovascular disease related, cancer related, type 2 diabetes related, and obesity related mortality. In every instance, if you adhere to the strengthening guidelines, you get a reduction in risk. And you can see there, it's pretty impressive for type 2 diabetes. Again, in every instance, you get a reduction in risk if you adhere to the aerobic guidelines. A little bit greater for all cause, greater for cardiovascular disease, about the same for cancer, the same for type 2 diabetes, and maybe not quite as good for obesity. But the green bar shows what happens when you do both. 6.6, so about a 40%, 0.5, so about 50%, 0.65, so about 35%, 60%, and 40%. Again, pills that reduce your risk, all-cause mortality by about 40%, by about 50%, by about 35%, by about 60%. Those are astonishing. If it were a pill, it would be a medical miracle. It would probably knock vaccines off of the top of the heap. But the point I want to make is it's maybe not about your mortality risk. And I said quality of life, and I said the ability to move around. So a lot of you know that old age is associated with disability, the inability to be able to move physically around your It begins with your neighborhood. You may lose even the ability to drive is going to reduce the amount of area that you can cover in a given day. But if you can't walk and if you can't get around, and eventually if you can't get off of a chair, then you're in full-time institutionalized care. And I'll just show you a graph here, and really I won't go over the nitty-gritty of it here, but what it shows you is that the effects of resistance training, so weightlifting, and the more potent those effects are, the lower the self-reported disability people have. So the stronger people are and the stronger they're made to become by engaging in weightlifting type activities, they report a lower incidence of disability or the inability to move around. Quite a few people submitted questions about osteoporosis. Osteoporosis is a painful, debilitating disease, a tremendous burden in terms of morbidity. And the reality is that a lot of people say exercise is good for osteoporosis, and they would recommend walking. But when you look at the literature that's out there, and this is a systematic review, meta-analysis of randomized controlled trials with resistance training, so with weightlifting and strengthening exercises, particularly those that don't involve your body weight, but pushing against weight on a machine, are the most effective at reducing the symptoms of osteoporosis and maybe even slowing the bone loss that happens. Knee osteoarthritis. I could put hip osteoarthritis here. I could put hand, shoulder, you name the joint. This is the wear and tear arthritis. And again, the role of resistance training dosing on pain, physical functions in individuals. This is with knee OA, knee osteoarthritis, and the effects are remarkably positive. Coming close to the end here, but I don't think anybody would disagree with me in saying that falls are a watershed moment for older people, particularly the oldest old. We know that a hip fracture past the age of 80 has a mortality rate 2 years post-fracture of about 50%. So what do we do to prevent falls? Well, there's a lot of, in-home audits that you can do to clear things around the house, and that's a great way to begin. But to proof yourself against falls, you need to engage in strengthening exercises, and this is where balance comes in. So practicing balancing exercises, stepping over obstacles, what we call one-legged or tandem stances to try and improve your ability to be able to balance yourself. And when you do that, your fall risk is unequivocally reduced. So we have evidence-based support for strengthening in lowering the risk of mortality and or improving the prognosis of cardiovascular disease, type 2 diabetes, cancer, osteoporosis, osteoarthritis, and falls, but we do need to add a little bit of balance to that. So everybody's with me now, right? Everybody's a convert. What do we do? What are we going to do? So I'm going to wax a little poetic at the end here, and I'm going to give you my take on what it means to age well. And I like to tell people it's like sitting on a stool. The stool has 3 legs. Here's the first and most important leg. It's to be physically active, to incorporate exercise if that's your thing, if you like to do that, but definitely to move around, to sit less, to try and get that 150 minutes or 2.5 hours in. That's 5 days a week, 30 minutes of physical activity. You can cut it up into very small chunks. If it's intense physical activity like climbing stairs or walking up a hill, you can do less. That leaves you a lot of other hours in the day to do a lot of other things. So people who say, I don't have time, the answer is quickly find the time. It's there. You just need to make it a priority. So how does it begin? Find an activity you like. I've heard from a number of people, they say, I went to big box gym in January. They had a great membership deal. But then when I went there, I realized I was one of the older people there. I didn't really like how they spoke to me, treated me. I thought I didn't fit in. The music was really loud. It wasn't really, it didn't appeal to me at all. And I asked myself, and they said, I didn't go back. I'm like, no kidding. Why would anybody go back to something that they don't like to do? So find an activity that you like. Minutes count. Increase your activity level. 10 minutes at a time. Every little bit helps. And this is where I think a lot of, I'll just call it an injustice has been done in terms of you don't have to sweat. It doesn't require a knockdown, drag them out workout to achieve benefit. 10 minutes, perfect. Get up, move, go for a walk. Active time can be social time. If you enjoy time with other people, look for group activities or classes in your community. Get together with family and friends. It doesn't have to be something that is an arduous grind that you do by yourself, that is some sort of physically punishing task. It's fine if you do, if you like to walk or listen to music, or if you like to walk and listen to nature, awesome. But if you're like somebody who, likes other people, likes a little bit of chatter, try and incorporate that. Walk wherever and whenever you can. Take the stairs instead of the elevator when possible. My good friend and happens to be my spouse and I recently completed a study in cardiovascular disease patients undergoing cardiac rehab. And the form of exercise we chose to get them to do was just stair climbing. And I thought to myself going into this is crazy. There's no way these people are going to achieve any kind of benefit. And they achieved exactly the same kind of benefit in recovering from a cardiac event as people who followed the traditional in-gym cardiovascular rehabilitation. It's astonishing what climbing stairs can do. You get to the top of the stairs and people don't like to take them because they're like, oh, that's my heart's beating like a rabbit. It's a really, really potent form of activity. Carry your groceries home. Resistance exercise, probably weightlifting, is not people's favorite, although I'll say to, get a gym, lift some weights. There are lots of ways to make yourself stronger that don't require a gym membership of lifting weights that you can do at home. There's lots of online strengthening programs that use your own body weight. What's the second leg? Well, eat well. And I'm not going to give you any specific advice here. I could spend the next hour and a half, 2 hours talking about this. It is the other part of what I do here. We talk about dietary manipulation, but I'll just say, eat whole foods, eat the stuff that is around the outside of the grocery store, not down the aisles in the middle. And that tends to work relatively well. The third leg is to engage socially. The COVID pandemic showed us what it meant for older people to live in isolation. People don't do well when they're lonely. They become depressed, things become amplified, and things tend to go downhill. Try and engage in the traditional sense of a social network. Online social, fine. But for me, it means talking to people, to actually spend time with people, with friends, with family members, and have a sense of purpose in life. It can be, for some people, spiritual. I've been told that there should be a fourth leg on the stool. And of course, given the guidelines, it probably should be the leg that supports sleep. But I think when you get these three legs together, aging well happens. But I do think that being physically active is the key part of it. So as I said, maybe it's a four-legged stool and it's sleep on the other one. So I'm going to quote somebody at the end here. This is Ron Davis. He was the American Medical Association president. Unfortunately, not a particularly successful ager. He died of prostate cancer in 2008, but this is his quote. If we had a pill or surgery that contained all the benefits of exercise, it would be the most widely prescribed drug or procedure in the world. So remembering the question that was posed in the video, apologize if you didn't hear it, that your last 10 years, or maybe your last 20 years, or maybe for some of us, even our last 30 years, are years that we would like to spend with good quality of life. Mortality is still 100%. Death and taxes, the only two certain things in life. And so it's the quality of the life that you spend. I want to say thank you very much again to the folks at the Optimal Aging Portal and McMaster Alumni for allowing me to share my thoughts this evening.